Okay, so what we are now going to be testing for is for the joint mobility of the proximal tibiofibular joint. So to do this, we're specifically testing it in the posterior direction. So we're going to be providing a mobilization force posteriorly and medially. So what we're going to do here is we're going to have Chase lying supine. Now I'm going to just go ahead and sit on his foot to stabilize the distal aspect. I'm going to go ahead and find my fingers on either side of his head of the fibula. And what I'm going to do is I'm going to go ahead and provide my glide in this direction. And what I'm assessing for is I'm assessing for the end feel. I'm also assessing for the range of motion that the fibular head moves from the tibia. And I'm also going to be assessing to make sure this doesn't give the patient any pain. A positive test would be an increased range of motion, an abnormal end feel, and if the patient experiences pain as I'm testing this for the joint mobility. So my fingers are on either side of the patella. I'm going to go ahead and provide a posterior medial force. And I should have a firm end feel. So an abnormal end feel could be a positive indication for this test. I am going to go ahead and do the same thing also on Chase's other side. So I'm going to stabilize by go ahead and sitting on the patient's foot. I'm going to put my fingers on either side of Chase's fibular head, and I'm going to go ahead and provide my force in a posterior medial direction. And for Chase, I had a firm end feel. He did not have any pain, and there was minimal movement, and so this would be a negative test.